Welcome to this GCSE Biology revision video on reproductive biology and fertility treatments. We will explore infertility, how hormonal treatments work, the steps of IVF, and key considerations for your exams. In this video, we will cover 4 main areas: the definition and causes of infertility, the use of FSH and LH as hormonal treatments, the detailed procedure of in vitro fertilization, and finally, important ethical and practical considerations. First, let's define infertility. It is the inability to conceive naturally after regular, unprotected intercourse over a period of time. It is a medical condition affecting both men and women, but it is important to remember it is not always permanent, as many people conceive after successful treatment. Infertility is complex. Female factors include irregular ovulation or hormonal imbalances. Male factors often involve sperm count or motility issues. There are also other factors like age, lifestyle choices such as smoking, or unexplained medical conditions. When the body does not produce enough natural reproductive hormones, artificial hormones can be used as a fertility treatment to stimulate the reproductive system. The menstrual cycle relies on the pituitary gland, which produces FSH and LH. FSH, or follicle-stimulating hormone, helps eggs mature in the ovaries. LH, or luteinizing hormone, then triggers the release of a mature egg, known as ovulation. Fertility drugs, which contain FSH and LH, are often the first line of treatment. They supplement natural hormone levels to stimulate the ovaries, helping restore the possibility of natural conception before considering more complex options like IVF. Specifically, FSH binds to ovarian receptors to stimulate follicle growth and maturation. If FSH levels are too low, follicles and eggs won't develop properly. Providing FSH as a drug fixes this, allowing egg development for natural conception or as part of the IVF process. Once a follicle matures, a surge in LH triggers ovulation. Without this LH surge, the egg remains trapped and cannot be fertilized. Consequently, LH is often given alongside FSH to ensure successful ovulation at the right time. For your exams, remember these key points. FSH matures the eggs. LH triggers ovulation. They are often used together to mimic the natural cycle, and while these drugs improve chances, they do not guarantee pregnancy. If fertility drugs are not enough, IVF, or in vitro fertilization, provides an alternative pathway by fertilizing eggs outside the human body. The term in vitro is Latin for in glass, referring to laboratory settings. A crucial exam tip: always state that in IVF, fertilization occurs outside the body, as this is the most frequently tested fact on this topic. The IVF process consists of 4 main stages: stimulation, egg collection, fertilization, and finally, embryo transfer. It is a multi-stage procedure that may require multiple cycles to achieve a successful pregnancy. Step 1 is hormone stimulation. The woman receives FSH injections for about 10 to 14 days. This causes superovulation, where multiple eggs are produced simultaneously instead of just one, increasing the chances for successful fertilization. Step 2 is egg collection. Doctors use an ultrasound-guided needle to collect mature eggs under sedation. This takes about 15 to 20 minutes. We collect multiple eggs to maximize the chances of creating at least one healthy embryo. Step 3 is sperm collection and preparation. The partner or a donor provides a sample, which is processed in the lab to isolate the healthiest, most motile sperm. These are then combined with the collected eggs in a controlled environment to allow fertilization. Step 4 is fertilization in the laboratory. This is the defining stage of IVF. Prepared sperm and mature eggs are placed together in a dish. The resulting fertilized eggs are called zygotes, which then divide to form embryos and are monitored in an incubator that mimics conditions inside the body. This slide illustrates early development. After fertilization, the zygote divides by mitosis. By days 3 to 5, it forms a cluster of cells called a blastocyst, which is the typical stage at which the embryo is transferred into the uterus. Step 5 is embryo selection. Not all embryos are of sufficient quality for transfer, so embryologists assess them for healthy growth, including symmetry and division rate. The highest quality embryos are chosen, while remaining viable ones may be frozen for future use. Step 6 is the final stage: embryo transfer. 1 or 2 of the best embryos are moved into the uterus using a flexible catheter. The embryos must then implant into the lining for pregnancy to begin. A test is typically taken 2 weeks later to see if it worked. In the UK, guidelines recommend transferring only 1 or 2 embryos at a time. While transferring more increases the success rate of a single cycle, it significantly raises the risk of a multiple pregnancy, which can be dangerous for both the mother and the babies. To summarize, the IVF process involves 5 main steps: hormone stimulation, egg collection, fertilization in the lab, embryo development in an incubator, and finally, the transfer of embryos into the uterus. Who does IVF help? It provides a vital route to parenthood for many who cannot conceive naturally, though it is important to understand it is not a guaranteed solution for every individual. IVF has evolved significantly since 1978. It helps couples with issues like blocked tubes or low sperm count, as well as same-sex couples and single individuals using donor gametes, making it a powerful tool for family building. When evaluating IVF, consider both benefits and limitations. Benefits include enabling biological parenthood and genetic screening. However, limitations include high costs, emotional and physical strain, health risks from multiple births, and declining success rates with age. IVF is expensive. Private cycles can cost thousands, and while some NHS funding exists, it is subject to a postcode lottery of eligibility. Because multiple cycles are often needed for success, the financial barrier can be substantial. Success is not guaranteed. As shown here, live birth rates per embryo transfer vary by age. Women under 35 have the highest success rates, which decreases age increases, reaching lower percentages for women over 42. Age is the most critical factor in IVF success because both the number and quality of eggs decline over time. Older eggs are more likely to have chromosomal abnormalities. Using donor eggs from younger women can significantly increase the chances of success for those over 40. Multiple births are a key risk of IVF. Transferring multiple embryos increases the chance of twins or triplets, which can lead to complications like premature birth. Consequently, single embryo transfer is now strongly encouraged, especially for younger patients. Finally, be prepared to discuss ethical concerns in your exams. These include the status and fate of unused embryos, the implications of genetic screening, religious objections to the process, and concerns regarding equitable access to treatment. When you are asked to evaluate IVF, you must present a balanced argument. Consider the benefits, like giving couples a chance to have a child or screening for genetic conditions, alongside drawbacks, such as high costs, the risks of multiple births, and ethical concerns regarding embryos. Understanding the core differences between fertility treatments is essential for your exams. This comparison will help you distinguish between standard hormonal support and the more intensive IVF procedure. Inside the IVF laboratory, scientists maintain a precise environment to mimic the human body. By strictly controlling temperature, pH, and gas levels in specialized incubators, they ensure the best possible conditions for embryos to develop before they are transferred. Let's review some key vocabulary. Infertility is the inability to conceive naturally. FSH stimulates egg maturation, while LH triggers ovulation. IVF is in vitro fertilization, where fertilization happens outside the body. Finally, an embryo is the early-stage cluster of cells that implants into the uterine lining. Avoid these common exam traps. Remember that fertilization in IVF always occurs outside the body, not in the uterus. Clearly distinguish between the roles of FSH and LH, and always note that IVF success isn't guaranteed and varies with age. Try this exam-style question. A couple are having difficulty conceiving. Describe how IVF could help them, including the role of hormones. Your answer should track the process from FSH-stimulated maturation and LH-triggered ovulation through to laboratory fertilization and eventual transfer. Here is another 4-mark evaluation question. You need to present 2 advantages, like enabling parenthood and genetic screening, and 2 disadvantages, such as the high cost and the health risks of multiple births. Let's test your knowledge. What does IVF stand for? Where does fertilization occur? Which hormone matures eggs, and which triggers release? How many embryos are transferred? And what happens to success rates with age? Cover the answers on the screen to practice. Remember these top 5 facts for your exam. IVF happens outside the body. FSH matures eggs while LH releases them. Typically only 1 or 2 embryos are transferred. Success decreases with age, and you must always provide balanced, ethical evaluations. You have completed the revision on fertility treatments. Remember the golden rule. IVF fertilization happens in a laboratory. Take time to review your notes, practice past paper questions, and check that your evaluation answers cover both benefits and ethical concerns.